Oh, I think it's unmuted.
Oh, now it is.
That's right. The lights are on.
Yep.
Oh, good. Thanks, Cal.
All right.
All right. Thanks, Brian.
Do everything first.
Just, maybe just.
Man of the hour.
I literally just got, and it turned right out.
Imagine. I'd like to call the meeting, the Health and Human Services meeting to order tonight. All of the members are here. If we want to do a roll call, we can. Christina Clarko here. Mike Didio. I see him on the video.
Mike, are you on?
Might be muted.
Yeah.
All right. Brian Muldrow,
Present.
Heidi Rosengelt, and Lydia Patty Ruffini,
Here.
and Robert Shea.
Here.
All right. Tonight, we only have 6 resolutions on the agenda. There's 2 health department resolutions, 1 from mental health, 1 from Department of Social Services, 1 office for the aging, and long anticipated 1 from the Youth Bureau. So there are no appointments tonight. So I'd like to get a motion to move the minutes of May 12th. If someone would make that.
Second.
Robert Shea and Christina. Yep, thank you very much. I did get a request from Brenda if there was a way that we would start with the 1 Office for the Aging resolution. You have been with your family, so if you'd like to come up. Brenda and I had talked about this resolution. It's really an authorization to fill 1 full-time account clerk support staff position in the Office for the Aging pending a retirement. And at this point, what she's really asking for is the ability to fill that position in advance of the end of the year retirement to accommodate a 12-week crossover training period, because this is the one who manages the fiscal operations of your office.
Correct.
And that you also, this will give you the flexibility to do a 12-week training, and you also have mobilized funds within your own budget to be able to have that period of crossover. That's pretty much.
Yep. And I just want to add that we have filled 2 retirements in the past year, other positions, and I haven't asked for the training period. This one is unique in that it is the most critical fiscal position in the office. This person handles all of our grants, all of our claims, all of our reporting, everything that's required for the state and feds for us to do what we do and get the reimbursement we get. So it's very complex, and the state doesn't offer any real training, so it really has to be done in-house. So really important that we have this overlap period.
Move.
Second.
Okay. Is there any questions about this?
I have a question. Obviously, it's budgeted. Thank you.
Budgeted salary funds.
And you anticipate around October 1st, bringing the potential new hire on and being able to work with the current incumbent until the person leaves?
Correct.
Because the person has no desire to come back after retirement to
Made
do
that
an
really
hour
clear.
of training.
Done when it's
Yes,
done. Yeah.
yes, because I talked to Brenda about that, and she said, well, that'd be a good idea, but that's not in the cards.
Right.
Okay, is there any other questions about that? Okay, all in favor?
Aye.
Any opposed? Okay, great.
Thank you.
Yep. Do you have anything you want to add to your report?
Just real quick, I want to just share with you and give kudos to our nutrition coordinator, Jenna Adams. Every year we give out $16,000 worth of senior farmers market coupons. It's quite a bit of work to set up all the drive-through distributions that we do throughout the county. Normally, she has that put together kind of mid to later June. This year, she got it done so early that we were able to get it in our newsletter that goes out to 4,500 seniors in the county. It was mailed out today. It's going in the Genoa Tribune, which goes out to our rural seniors in our southern part of the county. We've had kind of low participation rate out there. So to be able to put this in that newsletter, which only comes out quarterly, and the deadline was today. We were very pleased to have the information this year, have it scheduled, and so it can go out to all those people. So I just want to, say that's a little mini accomplishment, getting this kind of information out early so people can access and utilize these, especially the folks in the rural areas that we want to make sure that they get a chance to participate. Just a really quick update on our space. The IT cabling it's about, I think, 99% completed. So we're making some progress there. Painting's in the works, and that's coming along. And then I think the rest of it those of you that are coming to the volunteer picnic, we're really glad that you're coming. Those of you that can't come this year, hopefully next year, but we're looking forward to that event coming up next week. Yes. Okay.
I got one question. What do you consider an age for senior?
So by definition, under the Older Americans Act, it's 60 and over.
16 over.
Mhm.
Thanks, brother.
Which is one of the challenges. I'm sure you're aware that somebody in their like 60s to 70s is very different to someone who's in their 80s and 90s.
I'm aware of that.
Yeah.
So it makes
Thank you.
the work we do. Yeah, very challenging. We have very young seniors and then older seniors. Yeah.
Lydia? Thank you for all that you do for our seniors. NYSEG has had a billing issue. I believe one person that I'm aware of who is a senior, an 80s senior, has not been billed since January, February bill. Have you been made aware of any of this happening?
We've had individuals call with various billing issues and we've been able to resolve anything either through calling our contact at NYSEG. There's a customer service contact that we work with, or working with the HEAP program. So both ways we've been able to work through some of those issues. Yeah.
So if there are any folks who, and sometimes I forget whether or not a bill has been paid, and going back and not having been billed since January, which is the heaviest of months.
Right.
If there's anything that needs to be considered that we can help with, if you could please let me know. I'm not making a commitment that we will, but I'll make a commitment that I'll do what I can to help.
Okay, great. Appreciate that.
Thank you.
Who's billing?
Yeah, is that a common?
NYSEG.
Is that a
Are
common?
you saying like NYSEC?
NYSEG, New York State Electric and Gas. They had a billing issue because of their solar farms program, and they're that far behind on their billing. It hasn't impacted everybody. I know it hasn't impacted me, other than they did an extended estimate. So where I normally get $100 to $200 bills, I got a $547 bill.
Yes, that happened to me also.
So, and for someone who is older, that is a bigger issue. Most of the elderly that I'm aware of know that something is missing and they catch on to that quickly. But with the increase in NYSEG rates, in addition to this, it could pose an issue.
Elaine?
Oh, I'm sorry.
Still look back here once in a while.
Yeah.
I'd like to thank you for clarifying the definition of a senior. I only have 10 more years to go. How is the space, the new space over there? Do you have a lot more room? Is it more conducive to privacy, and will the cubicles, are they sufficient enough, or?
I think they will be. We just actually had a full staff meeting today. To be honest, we were trying to, it felt like cram a square peg in a round hole, trying to just move our current staff over to the new space because it's bigger than what we have now, but it's chopped up. And we were just having trouble programmatically putting the people that do the same thing together, because one of the strengths of the work they do is collaborating for the best interest of our clients, as far as their learning, as far as their, things like that were just brought up by Lydia. One hears about it, they all hear about it. That's really important. So we just had a really good staff meeting where we got everybody involved in brainstorming of, we may actually be moving multiple people around to optimize that space and optimize the private space and optimize the private meeting rooms that we're going to need. So we're really moving along. So it's coming together.
Glad to hear it.
Thank you.
Thanks, Brenda.
Anybody else?
Thank you so much.
Thanks, Brenda.
Thank you.
Great job.
If no one objects, I'd like to just go on to HH6 that was recently added. Thank Chris for working on the resolution. And this is basically coming out of the work of the small group that we put together, Heidi, myself, Lydia, Trish, Dave, and Lloyd participated as well. And this resolution, if it passes, will allow for the filling of the Youth Bureau Director position. It's been, the position has been evaluated. It has been classified by the Civil Service Commission. It is being recommended as a grade 4 starting salary. There is current funds in the current 2022 Youth Bureau budget to cover the hiring of this position through the end of the year. If this passes, it will be full-time, and I think it would demonstrate our commitment to reinvigorate our investment and commitment to youth development and delinquency prevention. So we have high hopes that this new hire will get the youth bureau, the youth board redrawn and reappointed, and look at the needs assessment of the community, and look for additional funding as well as the OCFS funding that comes in. So I'd like a motion, if I could, to for HH6 to fill the full-time youth bureau director position.
Is there a conflict if I move?
If you move it? No, not at all.
Move.
Okay,
I'll second.
all right. And
One question, quick. You said, what's the salary of this position?
the salary it's graded as a grade 4, and the starting range of that is 61,746. And I think the high range goes potentially close to 71,000, but that's where HR will come in, look at the minimum quals of the candidate and place them in a range, a higher range.
When is this position available?
This resolution, because it will be a hire of the county legislature. If this resolution passes, HR will start the advertisement and bring the candidates in. And it also alludes to a small hiring committee being formed by the chairman and, bringing in candidates to be recommended.
Okay.
So I'm sure if this passes, HR will begin the, however they advertise.
It's a full-time position?
It is.
So it's no longer a stipend like before when somebody had a position that was shared?
Well, we went back in the history, and Lloyd really was appointed in 70-something as a full-time youth bureau director. And it then sort of morphed into part-time work because of his role in the assigned council. But,
But this is a full-time.
but this is a full-time position, yes.
Okay. Good.
Yes,
And the reason why it morphed into a part-time position, Brian, is because more responsibilities got added to Lloyd. So these requirements and everything that it benefited to the youth kind of got put on the back burner. The youth programs that are offered throughout the county have severely suffered.
Oh, I know it. I know. And what about the this position? Do we have this is for the county, the entire county?
Yep.
They have a staff, there's a budget attached to it all?
At this point in time, there is this would be the youth bureau director. The only operating capital they have is the money that comes in from the Office of Children and Family Services. That has now, I think, because some of the funding went to DSS, has really come down to, after they cover a small administrative portion of the salary, probably 70, not more than $80,000. There are certain contracts that have been in place for a while. I assume this new director will be reevaluating where we have invested that money. And part of the job of this particular individual is to start looking for additional funding to bring into the county. There has been preliminary conversations of using $250,000 of ARPA funds to add to this $70,000 so that there could be some initial investments in youth development while this person gets up to speed and finds other ways to get funding into this community.
Okay, just one comment. I just want to thank everybody. We started on this in January, actually, with Lloyd and a lot of you, and I appreciate it. I agree with everybody in here that we need to take care of our youth, and it's been neglected for a long time. So this is a great start. I want to thank a lot of you for doing it. I know a lot of you were involved in this, and I really appreciate it. And I fully support this. So thank you again.
Thank you. Okay, did we get a motion in a second? We did.
Yes.
All in favor?
Aye.
Okay, no one opposed. All right, if we can just really move backwards, if we could go to HH4, which is authorizing the Social Services Commissioner to fill a full-time caseworker position in the child welfare section. And I asked Christine on the side if, obviously, this is a budgeted position and this is one of the only vacancies that you have left.
For caseworkers?
for caseworkers? Is that?
Yeah.
That's great.
So this caseworker was not here for very long. She actually came in and was trained and went through the training program and made the decision to leave us and go to Oswego County Department of Social Services to work as a caseworker there. So we didn't have her for long and really didn't even get her up to speed before she made the decision to leave. So we quickly did a resolution to ask her to fill and hopefully we'll get someone back in. It's the training program that we have is long and it's intensive, and we have a few workers that have just started and are going to be starting training. We have some other caseworkers that are kind of in the pipeline of going through training. So our staff is, our staff numbers are good, but we have a lot of staff that aren't up to full speed and don't have full caseloads. And so that's very taxing on the staff that we have, the more senior staff, the staff that are ready to take full caseloads.
But at one point you had 4 or 5
Yep.
vacancies, so that's
Doing better for that.
a little bit.
So yes, it's budgeted and we're seeking to fill it.
Okay, you didn't have any updates? Is there anything you want to share with the committee?
So for updates, I did want to announce that I have hired my deputy commissioner.
Before we go, can we get a motion and a second for the change?
Move it. Second.
Okay, any
I
in
have a
favor?
question.
Okay.
What was the cause of the termination? I mean, what did she say?
She resigned.
No,
I-
she lived closer to us.
She lived closer to Oswego County. She lived up north. She was traveling quite a ways down, cost of gas.
Did the Oswego County one just become open, or was it
My understanding is
a
yes.
higher salary? Or
I'm not sure about a higher salary. Maybe John knows that's.
It's not a higher, it's
Not
not
a
a
so it's just a
salary.
comparable salary.
They had
gas
opened up,
prices go up.
they had froze the positions to all the media, and now they've
Yes.
unfroze their hiring.
Yeah, they've made a decision to hire workers. So she
Yes.
made the decision to stay closer to home. So that's good.
Thank you.
Where am I at?
You're at telling me, us.
Okay, I can talk.
I think everyone,
We're gonna
we need to
vote.
all in favor?
Aye.
Any opposed? Good. Okay, great. Go ahead.
So I have hired my deputy commissioner, Jen Marshall. She's here tonight. Very excited to have Jen come on board as deputy commissioner here. She's been with us for about 4.5 years as our staff development supervisor. She has a lot of experience prior to, being with us in the department as in staff development that will also, lend itself very well, I think, to the work that we need to do, and very happy to have her help and their wisdom and it'd be a good thing. So I also brought a little bit of information from one of the workers that deals with our emergency housing area in the department, and I was just going to read what he had written to me last week, which I think is very exciting. We had ended our month of May with 73 folks being housed. That includes families and individuals, but that's very great news. It was a pretty significant decrease, bringing us back down to what he says is more of our normal range of things that existed pre-COVID.
Because it was 100 and something prior.
Yeah.
Yeah.
So our average for this week, this kind of time of year is usually about 57 total, individuals and families being housed. And so right now we're about 27% higher than we were pre-COVID. Huge drop. We were in the thick of things in the moratorium. We were about 70 to 120% higher than our normal numbers. So it's creeping down. It's slow and steady getting down there. We're having some success with finding people permanent housing, which we had not really been able to do as easily before. So
Why is that, do you think?
I think the housing stock's moving. I think, there's been some folks that have been evicted from apartments that they weren't paying rent from. So it's opened up some space for people to move in that were being housed in temporary housing. I think that's a big part of it. Some of it probably has to do with it's warmer weather right now, and folks find other places to stay, when it's not so cold outside. So I think moving in the right direction, which is exciting.
And you're certainly no longer housing people that are sanctioned because of the code.
Right. That's right. That helps.
It's great.
So, and I also wanted to say, just with housing and kind of the issues with emergency housing, I have been working with the city, attended a couple of meetings with a number of folks from the city code, city manager, some folks from the fire department, police department. We're bringing in some providers, from other, not-for-profit agencies that are coming in just to talk about the issue and to talk about like what's on everyone's radar. Are there ways that we can collaborate and work together to help, kind of solve some problems? And, one of the things that we committed to doing, DSS committed to doing was before we will, if somebody's eligible for temporary housing, comes in and needs it, they have to give us when they find permanent housing, they have to give us a form from their landlord, that prospective landlord that they're, moving in with. This is this person's name. This is the address I want to move into. We're checking the building blocks database that the city has put up and we have access to make sure that the house that the folks want to move into has not been condemned. There's apparently quite a number of situations where landlords who have condemned properties are allowing folks to move in still. And so we don't want to be paying, department doesn't want to be paying money to the landlords when their houses are in condemned status. So I think that's one little small thing that we can do to try to, make a difference, with, trying to do better with the housing stock and, I guess send a message too that, we care about this and we're going to partner together with the city and I'll be on the same page. So, this is the start, I think, of meetings that we're going to have probably every few months to talk about, things like this. And I know they're glad to have us there. It was very educational, I think, to hear some of the things that they are saying that they're dealing with. And then we also had an opportunity to talk about some of our procedures and why we do things a certain way. And I think that was interesting for them to hear that perspective as well. So I think it was good partnership.
Yes, right.
Thank you for doing that. Would you like to meet when we met up in the circle over there with the, I don't know, I think I was in a meeting with, but that's one of the reasons one of the things I campaigned on was this issue. So anything I could do to help,
Okay,
let me know,
thank you.
because that's a big issue.
For sure.
As I was campaigning, I got to meet some people that were really nice, that were trying to keep their house up to, as best they could inside, but structurally, it was falling apart around them, and the landlords were not doing what they should have been doing to keep it. Not all cases, but in some cases. And I do appreciate, we do need some landlords to deal with those tough tenants as well. So anything I can do to help.
Thank you.
Any other questions, Chris? Great, thank you. Okay, going backwards, we can move on to HH3. Lauren, you have the one resolution authorizing the Director of Community Services to enter into a contract for part-time psychiatric duties at Community Mental Health. And if you guys recall, this was a resolution that we asked her to pull months before because, yes, the budget included money for a prescriber, but basically we asked that you not give us a range and not give us, these are the particular people we might be able to hire. But once you identified a prescriber and the rate you were going to pay, you would come back with this resolution indicating the contractor and the hourly rate to be paid. And you were successful to find this.
Yes, so her name is Sonia Sarajevo. She's been doing some work in Chemung County Clinic. She's got quite a bit of experience working with both children and adults, which is huge because we've seen such an increase in children and needing those services, as well as she is waivered for medication assisted treatment for substance use disorders as well, which I think we have only one prescriber who's doing that right now. So this will add to that, our capacity at the clinic as well.
Is this a psychiatrist as well?
It is a nurse, it's a psychiatric nurse practitioner.
Oh, okay.
Yes, which significantly lower cost in the clinic.
Than a
than
psychiatrist hourly rate?
Yes.
And can we get a motion for HH3?
Move it.
I'll second.
Okay. And you will work her based on the part-time hours she has available?
Yeah, so I think we said up to 26 hours. So that's going to be based on her other positions that she has as well, how many hours she can work at the clinic.
Dave?
Yeah, Lauren, that's That's a pretty good price, isn't it? $150.
It is, but I've also done some research talking to other DCSs and other clinics to see, and it's pretty comparable to some of the other ones.
I
as
think
well.
it's very-
I think it's hard
very
to find
reasonable.
too.
Good find.
Yes.
It's a good find, really.
Yeah.
Psychiatrists would be twice that.
Oh, it'd be at least 230, if not 250, if they see children usually.
Great, good find.
Yeah, we're really excited about it.
Good, congratulations.
And can we get a vote on this? All in favor?
Aye.
Aye. Anyone opposed? Any questions? Lauren, or you want to talk?
I know I didn't put any updates on here, but I just wanted to say for mobile crisis, we currently have posted the crisis case manager position. So we should be starting interviews for that fairly soon. We haven't gotten any of the applications yet from civil service, so I know they have to go through that process first. But we're hoping to have that person hired fairly soon. And then we also have a full-time social worker position that's posted as well. So that one might be a little bit harder to fill, but we need to fill that in order for us to be able to start the mobile crisis. But we're doing all the training and figuring out all of the billing now so that that's all situated, as well as the documentation, so that once we hire, we're able to start that as soon as we possibly can.
Because even if you use one of your current social workers, you have to have the vacancy filled so that you can staff the cases that they're seeing, right? I mean,
Yes, because their cases are very high and there would be,
right.
it wouldn't be able to happen without the hire of the full-time social worker first.
So when do you realistically, are you hopeful?
It's,
Few months?
I hope so. One of the things that's difficult is like even people who have just graduated, they have to be licensed. So there's usually like, there's a
Supervision.
time frame there that takes a while for them to get their license before we can hire them here. So that's the only thing that I'm just wondering about. Plus the workforce issues have just been across the board. So, but I am hopeful that we can get somebody here in the near future to fill that spot.
And that your pay is competitive with the county, so you could.
Yep.
Great. I'm sure the law enforcement and
Yeah.
everybody
know.
is in the emergency room especially.
Sooner the better.
is Really
I
looking
know,
at
I
this.
know. We're really excited to start it too. So hopefully sooner rather than later. And then just the other update, we've been working with the sheriff on the medication assisted treatment at the jail. We've had a couple of really good meetings and we hope that we're actually going to take a little field trip to Saratoga County Jail because they have sort of the model program in the state. So hopefully we can take some things from their program to be able to start and implement that in the very near future. I think our partnership has been really good so far. I'm really excited about that, getting started with those people that are really high risk, as well as we've also been talking about formalizing some school threat sort of teams with law enforcement and with mental health so that we can sort of, have that ironed out because of, well, everything that's happened, but also for us to be able to have a good response to those, especially in the rural schools that they don't have as much support located right in the schools. So that's in the works as well.
To mobilize a response there.
Yeah, a team of just making sure, when mobile crisis is available, that would be really easy to mobilize and do those assessments, but also to keep track of those people so we don't lose them, that there's some eyes on them and there's some checking in with them. We're in the process of setting up our first meeting, so I'm excited about what that's gonna look like too. So we don't lose kids and we get them into the treatment that they need. So
I was telling Lauren that it came up at JP that, as they start to put this MAT program at the jail, it has to be in there by October. You'll be talking with the sheriff about how this potential $100,000 that we accepted could be used to offset some of the costs. But at this point, who knows how many people, who knows what the cost of the medications will be, but there is some revenue to help get this started, correct?
yes, and we're hopeful that there will be some continued funding with the state as well going forward, that it's not just going to be the one-time funding because we have to pay for the medications.
Right.
So
And would you put a prescriber out there?
we already have two of our prescribers out there. Actually, Shalaya, who's at the clinic
Yeah.
doing medication assisted treatment, is already out at the jail. So
Okay.
she would be, she's been part of our meetings as well as for prescribing the medications out there too.
And I told Lauren that Brian told me directly, what a great working relationship that they both have had in trying to, pull this off and work together. So that's great.
Yeah, I would agree with that too. Yep. Any questions?
Did you have something, Dave?
You answered it. I knew it was mandated. I just didn't know the time frame. It's October, right?
October 1st.
Okay, thank you.
Okay, Kathleen, don't feel bad. Last but not least.
I don't feel bad.
In
Okay.
fact, I really, if you want to get out, just pass these.
I
want to talk.
Bundle them and go. Yeah. Okay, if you want to just, we'll start with HH1, which is your ability to contract with audiology services for kids in the 3 to 5 program.
Correct. That's a specialty service that's needed. Fortunately, it's not as in high demand as some of the therapies. But they really get to set the rate. They're the only game in town in upstate New York. But we do get some reimbursement for it. And to our benefit as a county, in the last 5 years, the amount annually has not exceeded $3,500. So it's worth it to us.
What's our rate of reimbursement by my dad?
It's complicated. So we submit everything to the state. We get 59.5% back, but then we get a little bit lesser for the Medicaid that they've given us. So it seems, it's complicated. I have to ask every time, like, am I saying this correctly? I ask our fiscal people.
So you can bill Medicaid. Medicaid will
Yes.
reimburse you if you have Medicaid eligible children.
Correct.
And then based on whatever else, they'll give you the remaining 59% off of
We
that. or-
submit all our therapies, and evaluations and transportation to the state. Get 59.5% back, but then the state chops off from that half the Medicaid as it goes on. Yeah. Which is about half of our children in preschool program right now are Medicaid eligible.
And I know you work very hard to make sure you get medical orders and get everything in place so that you can get the Medicaid dollars that are there.
It's been a really concerted effort, in particular now that, we're moving back into more typical program operations. We're really focused on that. It's our most expensive program.
Can we get a motion for HH1 to allow for this contract with BOCES for audiology services?
I'll move it. And Gail second.
Okay, any more questions? All in favor?
Aye.
Okay, great. And then your last resolution really is an offshoot of what you discussed last month, where you are looking to raise the itinerant traveling service providers for the kids that are in 3 to 5, where the county sets the rate.
Correct.
And you haven't moved the rate since 2017.
Right.
And this is your proposal, and as Kathleen and I spoke, she is using some unanticipated revenue that the health department got from the sale of a mobile home park to be able to cover the additional costs that might be generated from moving this rate effective July 1st.
Correct. And we are looking, if approved, to utilize July 1st as the start date, because that's the school year date, and that just makes billing and any adjustments online with the reimbursements that we get, this 59.5% that we get back. And in addition to that request for the rate change, I'd like to be able to extend the contract with these preschool special ed providers by 6 months, so that their contract fall is aligned then with the school year as well.
July 1 to June 30 is
Correct. Yep. Yeah. The contract will expire at the end of this year, and I'd like to extend it 6 months, have permission to.
Okay, can we get a motion for HH2 and then any questions that can come up? Okay,
I'll second.
all right. Do we have questions for Kathleen about this? I mean, kudos to you for finding the revenue in your budget to do it and accepting that unanticipated revenue. And
Yeah, it's a team effort. It came through environmental health, but we're applying it to this.
you're hoping that this will increase your pool of kids and get some of these kids off the waiting list. Who knows?
That's our desire. Yes, and we certainly hope that will be.
Should have bumped.
We should have bundled this. That's right. Okay, any more questions about this? All right, did we get a motion in a second? A motion? Yes, all in favor?
Aye.
All right, okay. Yeah. Do you have anything?
No, I have some things.
Because you have till 10 after 6, Bob says. Well, in that case, maybe I'll try to garner some brownie points and say we wrote down some good stuff here and it's, be on the look at outdoor time. We just want to encourage people to remember that there's a lot of tick and mosquito borne diseases and we start to see more so of that in the weather when people are outdoors more. So be aware, and there's information on our website about it. Thank you. You wanted to have some time on the agenda?
too, please.
Yes.
So a couple of questions. I have been fortunate or unfortunate enough to have been exposed to Auburn Community Hospital. And one of my questions is, when are hours going to be extended again? I believe that we are under some sort of a state mandate that is restricting us
For visitation.
2 hours a day.
That really is, it's facility based on how they choose to operate during COVID. It's not locally based, but I'm trying to get a better feel for not just the impact it has in hospitals and in nursing facilities, rehabs, things like that, because unfortunately, I've had some similar circumstances lately as well. The mask use for regulated facilities also is a question that's coming up around the state. Now, right now, there's some counties that are still in high transmission, although our county is not right now. So that's a question that I have up at the state level to say, at what point will this become an option for facilities to make that choice or counties to make that choice? I don't have an answer for you at this time.
So I went through RN training, and the only reason I didn't complete it was because I wasn't going to go on social services to finish out one semester. So I may have gone through the same training that you did. I went to community college, Stella White. You probably know
I know
Stella.
you give me credit. I'm not a nurse, but I do know Stella White's name. Yes.
So one of the important things that we learn is the importance of our family and our significant others. Specifically, and this might surprise some of you, specifically to our ability to heal. There's a huge impact on healing with having our people around us. So I see this as an issue that is causing maybe extended care to be required. So what I would say is, if we have to maybe find out if there's ARPA funding, that we backtrack a little bit. So if the state is withholding funds to our county, holding us hostage, and there's something that we can do from a county level, I would like to support whatever has to be done that way.
I'm not aware that there's any funds being impacted by that. I think it's really the thought of infectious disease control, but I agree with you, the emotional toll is significant.
If I'm not mistaken, there is no state directive that's forcing the visitation policy at Auburn Community Hospital. It's their policy. And basically you would talk with potentially Christine Prospero at the hospital and almost lodge a complaint and say, hey, look, I want to talk to you about the fact that my visitation is being limited and what's the hospital's plan for that. So you certainly, that would be the name that I would start with.
And I know the name, I know the person.
Yep.
And there are also care staff from both a PA perspective and a nurse perspective that they share similar concerns.
Yep.
Because there are patients who cannot advocate for themselves. There are patients who just need that. And the nurses prefer it, and the PAs prefer it. So if there are no state or county guidelines, then I'll take it on from a personal perspective.
So,
I'll make mention of it.
Lydia, what you're saying is they only let you stay 2 hours?
You are only allowed to visit a patient at Auburn Community Hospital other than critical care
Or
in the
come
general
and
environment from 4 p.m. to 6 p.m. every day.
Wow, I
That's
didn't,
the only time.
that hasn't changed. I know that was during COVID, so that's still there
That
now.
is still in effect.
Probably
Absolutely.
only one person in the ED with someone too. I mean, there are.
Only
yes.
one person in the emergency room. Yes.
Yeah.
There's no accommodations for people that 4 to 6, like that might not be a time that they could,
No.
no accommodations at all.
No, and I did ask if there could be any exceptions made. And under what circumstances, I talked to the nurse supervisor, I talked to the nurse manager, I talked to several different people. I did not talk to Ms. D. Prospero yet. But there are no exceptions. You can take your person out of the hospital essentially, and they don't recommend you do that.
I didn't realize that.
So Lydia, can I have a suggestion for you? Obviously, this is not a county, this is an issue because it's in our county, but it's not a county ran. I think, this is a unique thing because you wouldn't really know about this unless you had somebody sick in the hospital. So I think,
Exactly.
so it's a select people and they're under distress, and by the time they probably get through the situation, the person's home.
Yes,
Or,
and they move on.
they move on. So I think that just maybe some emails from some legislators might make a difference. So if you would like to send an email or propose a letter, I would like to sign it and help you with that.
Yes, and I'd be more than happy.
I
on
So I
your-
think as a group, I think because
I'm on their board. I'm more than happy to
Yeah.
bring this forward. It's a big concern of yours.
That would be
I
great.
certainly will.
because my thought process is if you write a letter, right, and you're gonna voice your opinion, we know you have opinions, right? So they'll hear it, but the point is, I think that they'll hear it maybe a little bit heavier than somebody else, but
The more the merrier.
as a group, we're able to do something. I think it's gonna set a statement. So rather than an opinion, it's more of a statement. So I'm willing, you would have me, whatever you want me to do, but I think I would endorse it. I will write a letter as well.
Thank
I
you.
agree with Kathleen. It's much more traumatic for seniors in the hospital who can't have family visitation.
Nursing home and patients, all of that. Yes, it's been very difficult.
It's horrible.
So that's, I didn't realize how bad that was still in place with that.
Thank you.
I listen, when you first said this, the reason why I won't clear, I thought like you can only stay for 2 hours at a time, but it's only from 4 to 6.
And one person only, I think.
I didn't see a restriction for that. The one person restriction is in the emergency department.
Yeah.
You can only have one person in the ED room with you.
I can say in one of the Syracuse hospitals, it's one
Yeah.
person, but it's a broader range of time.
Thank you for that, and thank you for clarifying that it is not a county issue. That's important. And then the second thing is there anything from a county level that we can do to help with the nursing shortage? We have 22 patients and 2 nurses. Can you imagine?
I want to give that a little bit of thought. It's and it was something actually that I was going to talk with Elaine about, even just within our department, which used to be considered kind of the sweet spot to work if you were a nurse, right? Because you didn't have weekends typically and things like that. We still have a vacancy pending that I'll probably have to bring back before the legislature as we try to build things back up. It's part of my thought is flexibility, right? But again, that's very facility based. We know that there's a lot of people who want to say, 3 days, 4 off, and great if you have the skill sets. It's having appropriately trained people as well. Let me think a little bit more about that.
Appreciate it.
Yeah.
Thank you.
Dave?
Yeah, Elaine and I are both on the board, as you know, and we've talked about this at many meetings, probably every month we talk about it. And it's no consolation, but every other hospital's the same way. I have a friend in upstate right now, and they are the same way. They're down hundreds of nurses. We're probably down, I think, on an average 30 at a time. So they just can't find the nurses. Traveling nurses are coming in all the time, but they're overwhelmed.
200 and probably close to $200 an hour.
Yeah.
Hospitals are
I was
paying
gonna
for
say, a
travelers.
lot of the,
Yes.
95 an hour.
Employees are going that way because they
Try and get it.
Yeah.
And that is a big issue, not just the cost.
I think so.
But they're working with people who are making significantly less,
Yeah.
working significantly harder, and it is really impeding morale.
So that's the problem right there. If you're paying a nurse $200 an hour, I'm gonna hop in my car and go to Watertown. Get my $200.
The hospitals are paying.
Doing the same thing, though.
On
Right, that-
travelers.
All the hospitals.
What I'm saying, that you're better off as a nurse and you're gonna travel someplace else.
Yeah, it's just hard finding traveling nurses because if you have a family, it's really hard on you.
Yeah, you're right.
So, but we are short all over.
We know there's a huge financial motivation, right? But absolutely, it goes to morale also. The work doesn't get easier. In fact, it's only harder when you don't have support people, right?
Brenda has mentioned from Office of Aging over the last several months how dire the situation is with our home health, even aides, that there's virtually no one that they can find when they're, contracting with the companies who provide that.
Are there any county restrictions that are causing this?
For nursing,
Or what is happening? We've always had nursing shortages. It's been a constant, but it's gotten worse.
my first inclination is to say when it came to home health aides and CNAs, it was low pay, yes, for hard work. That's being looked at, we think, but I think our census and there's, I'm hearing everybody talk about, there's such a demand for responsible, reliable employees, particularly with certain skill sets, that they're often in the driver's seat. So to find something, and this is a great discussion, I think probably department heads may have some thoughts, but HR certainly will, and have creative ways to incentivize, not just monetarily, but to make the positions enticing.
Hiring bonuses, they're doing all of those.
I'm sure, and
It's a good point.
and you want to work locally, right?
But it really started when COVID started. Nurses that were age of retirement were leaving because they didn't want to work 14 hours a day, 12 hours, and the young people that were going into nursing at that time stopped going into nursing because of what happened in COVID. Nurses were dying. They were around the front line. So that's when it really, the decrease, at least what I'm understanding from our board, that's when the decrease really started, when COVID started. The older people that wanted to retire were going, that probably wouldn't have gone if COVID hadn't hit. We'd still have a shortage, but nothing like we are now.
And I got.
That's what I understand.
And I think communities like us were probably affected because Dave's right, all those things probably happen. And then if you're a nurse and you're busting your butt every day and you're getting normal pay, and then somebody offers you $200 an hour to go to a community, because I know some nurses, when you take travel nurses, you think they go to, some people go to major cities, but also they just might go 20 miles that way, whatever mile, and get their 200. So nobody really, it's an issue.
Same thing is happening in the education field. Education programs, the enrollment for new teachers are just at rock bottom. Nobody wants to enter education anymore either. We just have some challenges, big challenges.
Enticing for the educated. So I'm just speaking, and Christina, you probably know better, but I have one of my children who's graduating from high school. He says, I think there must be at least a dozen people who express interest in wanting to go into nursing because they've heard so much about it, in particular due to COVID. It's hopeful, but that's still years down the road until that happens.
Whatever you need to do, I don't think there's anybody in this room that wouldn't help you with these hours of visitation. I actually, Elaine and I could bring it up in a meeting, and I think we certainly will.
Yeah.
And I agree with you. COVID is not over, but the hours certainly can be changed. It's not up to me to do it, but I will certainly be an advocate for you to help you.
Yep.
Absolutely.
Thanks.
Thanks, Kathleen.
Thanks, Kathleen.
Trish, was there something that you were hoping to quickly talk about?
Yes. I definitely just wanted to comment too on the nursing situation. Being on the board of trustees for the college, one of the things that has been looked at by the leadership team there is different supports to improve the graduation rates and make sure that people are getting through that program, which is a top program in the state. So there's different things happening at the college as well regarding that to try to increase the number of nurses coming out of that program. But I wanted to just introduce the concept tonight. I was hoping to have a draft resolution for people to look at. I just haven't had a chance to work on it. I don't think it has to go through HHS particularly, but it would be an ARPA resolution to set aside some funding for the not-for-profits in the county to address some of the challenges that they've experienced through COVID. I know the cities allocated ARPA funding for this purpose and issued an RFP process. They kind of did a two-tiered program funding both capital improvements and program/operational projects. I have a call into Jenny Haynes. We're trying to schedule a time to meet to talk so I can get more information about the city's program and how they've addressed nonprofit needs. But I think this is an issue that is something I would love to see us address, putting aside some funding so that our nonprofits have an opportunity to come to us and have their needs addressed as well. Many of them were on the front lines during COVID as well, working with people in crisis. We've had a rising needs across the county with suicide rates, overdoses, youth problems, all kinds of things in the human services field. I know I've had a few conversations about this, and I know that there's concerns about funding staff that would be ongoing after the time frame of the ARPA funding, because ARPA is one-time funding. So I think, if we were looking at funding projects, those are things we need to take into consideration, looking at sustainability. But I do think this is an opportunity for us to do some things in this community, maybe that we wouldn't otherwise be able to do, to try some things out, to reduce demand on services over the long term, and really help the people of this county become more self-sufficient. There's also not-for-profit cultural and historic organizations, veteran services organizations. There's a lot of different types of entities that fall into that not-for-profit category. So this is something that if we did put aside funding, I personally would like to have it be a broad enough in scope to be able to consider kind of the comprehensive needs in the community. I wanted to introduce it tonight and get some feedback, see what some initial questions or concerns might be about something like that. And just to get it on the radar and get some feedback.
I guess my first, do you have any sense of what the city has funded? Or there's just in the process now, or what types of programs? I know that the health network, community outreach and advocacy for homelessness was something that they were going to be considering, but do you have other examples?
I don't tonight, Elaine. I will. I can certainly bring those back or even communicate them through email. Like
I think a lot of people here, Trish, when we met in leadership, struggled with what is it that you're looking at accomplishing by this money set aside? Are you addressing unmet community need? And to your point, sustainability is that the sort of criteria the city's using? That this has to address some unmet need in the county or community that we're living in?
Or the operational needs of the not-for-profit itself to be able to deliver those services that they are delivering. Might be a piece of equipment, might be might be a capital expenditure. There may be, I don't want to go into too many details and speculate because I think you get into trouble doing that. So I'd like to meet with Jenny. She's at a conference this week. We just haven't had a chance to nail down a date, but I can certainly get a better understanding of what their process is and what types of projects they've funded. And one of the thoughts was that there may be some great programs that they're funding in the city that, we could look at countywide if it makes sense to do so. So that there's equity of services across the whole county. Again, I don't have specific examples other than one thing that I'm personally interested in is looking at humane law enforcement programs. This is something that Tom Adessa came in and did a brief presentation on to Judicial and Public Safety a while back. I think there's merit in looking at supporting programs like that can shift the burden from our paid police officers to focus on human crimes while the humane officer is focusing on animal crimes. Better use of resources, potential savings impact to the county over time, things like that, where we can test something out, see what the impact is, and find a way to make it sustainable over the long term. That's one example, but there would be likely a committee established, not too different from what we were talking about with the small business grant program. I think it makes sense to have representation from both parties, I guess, as well as community members on that. The United Way has expressed some interest in matching funding to help move some of this forward. That's not in stone, but I've had some very positive conversations with Catherine Dennis about that, looking at, really partnering to address some of the county needs with our not-for-profit partners, our foundation partners, and some of our municipalities as well. Does that answer your question?
Any other questions for Trish?
I don't have a question, but I can give you an example of what was used in Auburn. I noticed that, for instance, the Cayuga Museum of History received ARPA funds. And you have to remember that our museums and our arts programs, they were closed. They weren't collecting fees for well over a year. Still had people on staff, but so the ability to get funds, and what I noticed that the museum did was they offered programming, free to the community to participate in. So I think, that's just another example of how far reaching we can define not-for-profit.
If I can, I just want to clarify the money that went to the museum, the Schweinfurt, the Willard Chapel, Seward House, I forget, there was another one, I think it was 5 historical sites. They were all in the midst of DRI projects. So it was to help make sure either the DRI was completed, as with Auburn Public Theater, like it allowed them to finish up what they were doing. It's going to allow Cayuga Museum and the Schweinfurt, that free programming that was coming out of the museum, the ARPA funds did not fund that. That came from the museum itself, that the ARPA funding, that $250,000 that each of those sites received is going directly to the DRI projects.
Downtown revitalization.
Yes. That we had all received, and
Yeah.
then COVID hit, and so projects have been stalled because of that.
Thanks, Trish.
Thanks, Trish.
Yeah, thanks. I appreciate the opportunity to talk about it. And I'm accessible through phone as well if anybody has any other further comments or thoughts. And as soon as I get information from the city, I'll share it out to the full legislature. Thanks.
Great.
Thank you.
Okay. Any other business? If not, can I entertain a motion to adjourn?
So move.
All right.
Bobby beat you.
You do need a second. I second it.